Hi, welcome to my channel where we talk about living a happy, healthy lifestyle. My name is Noor, and today we'll be talking about diabetes. What is diabetes? Well, diabetes is a chronic condition, which means it's reoccurring and can affect someone for a long period of time, which limits the body's ability to turn food into energy. So typically, we see that the pancreas is going to produce insulin, which is a hormone to help carbohydrates turn to glucose and get into the cell to later be used as energy. The problem is that some individuals either aren't producing enough insulin or aren't able to use it properly. There are three main types of diabetes that you should know about. The first is type 1 diabetes. This primarily affects young adults, children, and other teenagers because it's an autoimmune condition, and this is where the body attacks insulin-producing cells in the pancreas, meaning you can't even produce the insulin at all. So the second one is type 2 diabetes, and that's the most common type of diabetes. It develops in adults and can develop from lifestyle factors or genetic factors as well later on in life. But this is where the body is either resistant to insulin or the pancreas just can't produce enough of insulin. And the third type is gestational diabetes. So this develops during pregnancy in some women. And while typically gestational diabetes doesn't become an issue after the baby is born, you're at higher risk of developing type 2 diabetes later on in life if you've had gestational diabetes. Some symptoms of diabetes that you should know about. The first could be increased hunger or more thirst overall for drinks, and then sometimes you can have frequent urination accompanied with blurred vision, fatigue, or a lot of unexplained or possibly even sudden weight loss. So if you're experiencing these symptoms, especially if you're experiencing these symptoms all together, you should be consulting a healthcare provider to see if you need to get diagnosed. Managing diabetes can be done through lifestyle changes, but often does include taking some medication for some individuals. Managing diabetes can include having a healthier and more balanced diet. So that means whole grains, fruits, vegetables, lean proteins, and then having a lot of the good fats. That would be key. Regular exercise is also an important factor for controlling diabetes levels and high blood levels. Normally, I would recommend about 150 minutes a week, according to what I've seen online for recommendations. But I think that your healthcare provider and you should definitely have a discussion regarding what is appropriate for your body and a little bit more on how often you should check your blood sugar and your blood pressure levels, along with what your target range for your blood sugar levels should be. Prevention. So it's always easier to prevent than to treat. And this goes back to what I just mentioned about having a balanced diet, a healthy lifestyle, and then just maintaining a healthy weight. But that also goes down to eating less sugary foods and limiting alcohol consumption, just not smoking either. So that would be the conclusion for today's video. I hope you enjoyed learning a little bit more about the basics of diabetes. This will be a two-part series, so I'll go a little bit more into detail in the next video, but I hope that this was helpful. And if you did find this video helpful, please give it a like and share with your friends and family. If you have any recommendations for future videos, please share in the comments. Or if you have any questions, please also ask. I'd love to help. Thank you so much.